My name is Patience Stroop, and this is my service learning oral reflection from Babe Breastfeeding Coalition and Carter County Drug Prevention. So, who did I work with? The main person that I had contact with was the director, Jillian Reese. She was the person that I went to get started with this volunteering, and she is over both Babe Breastfeeding Coalition and Carter County Drug Prevention. These are her babies, and these are what she does. Her phone number is to the left, and the address is 546 East Elk Avenue in Elizabethton. That's where the office is for Carter County Drug Prevention, and that's where you can find her usually. She runs both Babe Breastfeeding Coalition and the Carter County Drug Prevention from that same office. So that's where it all begins. So what does BABE stand for? BABE stands for Breastfeeding Advocacy Benefits Everyone. Jillian established it in 2005 with her husband's help and has been running it ever since. BABE is a coalition of healthcare providers and community members with an interest in breastfeeding promotion. The BABE Coalition seeks to facilitate communication and build partnerships among health professionals and community members to promote a supportive breastfeeding environment in Northeast State Tennessee for mothers. BABE also has many events that mothers and children can get involved with. Two of the main things that she does is for mothers and family and for healthcare providers. So if you go to the link below, you can find many more classes than the one that I've listed below. But these are some of the main ones. So for mothers and families, there are, before the baby banquet, Circle of Moms, Mama Recharge, which is a support group for mothers, and Mama to Be, which is a nursing mama tea. And then there's also Safe Sitter class, which I also got to participate just recently with Jillian as something that they just had started. The Safe Sitter class teaches young children how to take care of younger children. So it gives them CPR from infants and young children to toddlers, and then of course it goes to teens. Then it talks about when they're in emergency, what they should do if they are babysitting or if they're not, things like that. Then it gives them things that they should say if they are in unsafe situations. And the phrase that they taught the kids when I was at was they need to text their parents, "I'm ready to be picked up now," and whatever that means, that parent needs to come pick them up. And those kids were taught that that is their phrase to get out of any unsafe situation while they're babysitting. That class also taught them responsibilities. It talked about how they need to make sure that they are available to go babysit, and being available means, since they are so young, that they need to communicate with their parents to make sure that they are able to go babysit, that they have a ride there, they have a ride home. The parents know where they will be, how many kids are babysitting, the parents of the children that they will be babysitting. It taught them all kinds of responsibilities like that. It also taught them about pricing and financing. Now that sounds like something that would be too informational for young kids that were at the Safe Sitter class, but it wasn't anything in depth. It was things like you need to make sure that before you go babysit, you can tell the parent that you have a price and that you would list your price, and that they would be able to pay you what you're asking for, and you wouldn't get there and the money would be awkward or the situation would be weird and you got yourself into a situation that you didn't know that you were getting yourself into, and things like that. So it was a lot about responsibility and pricing, which I thought was very beneficial for the students and kids there. And for healthcare providers, they have Kid Power event, certification for lactation counselor, and business case for breastfeeding. Now, the Carter County Drug Prevention has a mission. They want to reduce substance abuse through collaborative planning and community action and policy advocacy. Their vision is to create a safe and healthy Carter County. So what do they do? A coalition is required to focus on the following 7 Center for Substance Abuse Prevention. 7 strategies according to the Tennessee Department of Health and Substance Abuse Services and the National Substance Abuse and Mental Health Services. administration. So the first one is they have to provide information, and this is what I really got to get involved with. At the Covered Bridge event that I volunteered at with Jillian, they have a camper that they set up, and in the camper they have it set up as a child or teens room. And in the teens room, they have all kinds of items that are dispersed out through the room that you're supposed to look at and see if you can identify what they can use for drugs, or something that a parent could identify as being used as drugs. So what we did at the Covered Bridge was we would tell the people that came up to the booth what we were doing and why we were doing it, and we would give them a piece of paper that has questions on it, and they were to go through the camper and see if they could identify all of the 12 items that were in the camper, to see if their child was using drugs. And some of them were bloody Band-Aids, a blunt, pills, and things like that, but they were in specific places that parents wouldn't really know what to look for. So I got to be in that, and that was really neat because a lot of the parents that went through the camper really had no idea that some of the things their child could be using. So that was really beneficial, and we also got to give out brochures and pamphlets on things to look for, suicidal things, if your child was suicidal. So it was something really beneficial. I think that we were one of the only booths at the Covered Bridge that wasn't trying to sell things. Now we were trying to inform the community on the drugs in Carter County and what to look for in children. So they have to enhance the skills, they provide support, and there are a lot of support groups that they have for the Carter County drug prevention. There are a bunch of young kids that wanted to come volunteer as well. They've got clubs that Jillian runs, just to help support people in the community. They enhance access and reduce barriers. They change consequences, change physical design, and modify change policies. The activities that I participated in. So at Bathe, I retrieved items for the class, and those items were like babies for the babies to practice with, for the kids to practice with. They were diapers, so they would learn how to change diapers. I retrieved CPR dummies because they had to learn how to do CPR on infants and young children. I helped teach the Safe Sitter class as a whole. So I handed out their items that they needed, I answered questions, and I helped teach them the things that were in their book. I eliminated games for young children to play with during their mommy's classes, so that they weren't bored the entire time. And I reorganized and did the organization information scrapbook that Jillian has for people to look through so they can kind of get an idea of what Babe's for and what they do. And for the Carter County Drug Prevention, I ran the camper and / booth at the Covered Bridge days, which was really something fun to do that I really got to learn something in. I informed people in their community what to look out for in their children's possessions to notice if they are using drugs. And I reorganized and did the Prevention Center's information scrapbook that Jillian also has for people to look through and see what Carter County Drug Prevention is doing in the county. So the most memorable incident that I had was the Safe Sitter class. Honestly, I've babysitted before, but I think that there are some things that people forget that they need to notice. So for me, I think it was memorable because I got to see all of the younger kids learn really how serious babysitting is. And see light bulbs click on in their heads when they were like, oh, I didn't realize that mattered or this mattered. So it was really nice to educate younger kids on something that they're excited to get into. So my personal evaluation. Babe Breastfeeding Coalition and the Carter County Drug Prevention are both great organizations that are helping and informing many people. So, like I said, Jillian is a mom of 4 and is running both organizations with her whole heart. She loves her coalitions and referred to them as her babies. Her desire is to help parents and children in both organizations, and I think she's doing a great job of it. My experience was very pleasant and informative for me. I was able to make a good relationship with Jillian and would consider volunteering for her again, whether it is at BABE or the drug prevention, because both of them were very fun and educating for me. So for my field experience, I've shadowed a caseworker, I've taught that Safe Sitter class, I've worked on redacting many paperwork, and ran a booth at Covered Bridge to educate youth and adults about drug abuse. And for my accomplishments, I would say I received more education on things that will help me in my line of work, and I learned more about children and how to tend to their needs in the future in my line of work.